In this on-demand tutorial, we will be reviewing which CANS items can capture externalizing behaviors. Externalizing behaviors refer to behavioral problems that manifest in children's outward behavior and reflect the child negatively acting on external environments. The following CANS items capture externalizing behaviors. Number 16, re-experiencing. Number 33, social functioning. Number 36, legal. Number 41, school behavior. Number 43, school attendance. Number 48, psychosis. Number 60, anger control. Number 49, attention deficit impulse control. Number 52, oppositional behavior. Number 53, conduct. Number 54, substance abuse. And number 58, behavioral regression. Items within the child risk behavior domain can also capture externalizing behaviors. To learn more about how to score this domain, please watch the on-demand video entitled Child Risk Behaviors. Number 16, re-experiencing. Symptoms consist of intrusive memories or reminders of traumatic events. A child who is displaying externalizing behaviors may experience nightmares, flashbacks, repetitive play with themes of traumatic experiences, or intensive reliving of events. Looking at the scoring of number 16, re-experiencing, we see that a 1 is some problems with intrusion, including occasional nightmares about traumatic events. A 2, which is when we are getting into our actionable levels, the child may have some reoccurring frightening dreams or without recognizable content or recurrent distress in thoughts, images, perceptions, or memories of traumatic events. The child may exhibit trauma-specific reenactments through repetitive play with themes of trauma or intense physiological reactions to exposure to traumatic cues. And a 3, the child may exhibit traumatic-specific reenactments that include sexually or physically traumatizing other children or sexual play with adults. The child may also exhibit persistent flashbacks, illusions, or hallucinations that make it difficult for the child to function. Number 33, social functioning. This item is referring to the child's social functioning from a developmental perspective. It captures their ability to interact effectively with others and to build and maintain friendships. We often talk about number 70, social behavior, is not about how well the child is functioning socially. This item, number 33, social functioning, is where you will capture how a child is socially functioning. A child who's displaying externalizing behaviors may have difficulty interacting with others. They may also have difficulty building and maintaining lasting friendships. Looking at the item levels for number 33, social functioning, we see that a 1 is a child who is having some difficulty interacting with others and building and/or maintaining relationships. A 2, the child often has problems interacting with others and building and maintaining friendships. And a 3, the child is consistently and pervasively having problems interacting with others and building and maintaining those relationships. Number 36, legal. This item describes the child's, not the family's, involvement with the legal system. This could include involvement in the legal or adult justice systems. A child who's displaying externalizing behaviors may be involved in delinquent behavior that causes them to become involved in the legal system. Examples may include battery, fighting, or severe aggression or stealing. Items that may correlate to this item would be conduct, substance abuse, anger control, danger to others, delinquency, sexual aggression, and sexually reactive behaviors. When any of those items are scored, we may also want to consider scoring item 36, legal. Within the item levels for number 36, legal, we notice that 1 is some legal problems, but currently is not involved with the legal system and is not currently on parole or probation. A 2, the youth has some legal problems, is currently involved in the legal system, and may have active parole and/or probation mandates. And a 3, the youth has serious current or pending legal difficulties that place them at risk for a rearrest, or youth is currently incarcerated. Number 41, school behavior. This item rates the behavior of the child or youth in school or school-like setting. So this could be preschool or daycare. A child who's displaying externalizing behaviors may be displaying difficult school behaviors. Looking at the item levels for number 41, school behavior. A 1, mild behavioral problems at school, may be related to either relationships with teachers or peers. A single detention would be rated here. A 2, the child is having moderate problems with school behavior. They are disruptive and may receive sanctions, including suspensions or multiple detentions. And a 3 is severe problems with school behavior, frequent or severely disruptive. The school placement may be in jeopardy due to behavior. We also want to note that a rating of 3 would indicate a child who is still having problems after special efforts have been made, such as special education classes. Number 43, school attendance. A child who's displaying externalizing behaviors may be having school attendance concerns due to an unwillingness to attend school. Looking at the item levels for 43, school attendance, we see that a 1 is some problems attending school, although they generally go to school. They may miss up to 1 day per week on average, or they may have moderate to severe problems in the past 6 months, but have been attending school regularly in the past month. A 2, problems with school attendance. They are missing at least 2 days per week on average. And a 3, they are generally truant or refusing to go to school. 49, attention deficit impulse control. A child who is displaying externalizing behaviors may have attention deficit or impulse control concerns. Examples may include the inability to modulate their attention in a setting such as a classroom. A child that often interrupts others. This may also correlate with anger control, and if the child is impulsive with their aggression. Symptoms of attention deficit and hyperactivity disorder and impulse control disorder would be rated here. Inattention, distractibility, not related to opposition, would also be rated here. Item levels for number 49, attention deficit impulse control, include a 1, evidence of mild problems with attention, hyperactivity, or impulse control problems. The child may have some difficulty staying on task for an age-appropriate amount of time. A 2, moderate symptoms of attention, hyperactivity, or impulse control problems. A child who meets a DSM criteria for ADHD would be rated here. And 3, severe impairment of attention or dangerous impulse control problems. Frequent impulse behavior is observed or noted that carries considerable safety risks. An example of a 3 would be running in the street, dangerously driving, or dangerous bike riding. Number 52, oppositional behavior. This is compliance with authority. The item captures how the child relates to authority. Oppositional behavior is different from conduct disorder in that it emphasizes the behavior is a non-compliance with authority rather than inflicting damage or hurting others. A child who's displaying externalizing behaviors may have difficulty complying with authority or rules. The item levels for 52, oppositional behavior, include 1, the child has mild problems with compliance with some rules or adult instruction. Child may occasionally talk back to teachers, parents, or caregivers, and there may be letters or calls from the school. A 2, the child has moderate problems with compliance or rules or adult instruction. A child who meets criteria for oppositional defiant disorder in the DSM would be rated here. And 3, the child has severe problems with compliance with rules or adult instruction. A child rated at this level would be a severe case of oppositional defiant disorder. They would be virtually non-compliant. The child repeatedly ignores authority. Number 53, conduct. Symptoms include antisocial behaviors like shoplifting, lying, vandalism, cruelty to animals, and assault. A child who is displaying externalizing behaviors could have concerns about conduct. These behaviors may also correlate with other externalizing behaviors, such as, but not limited to, legal, impulse control, and anger control. Items for number 53 conduct include a 1, child may have some difficulties in school or home behavior. Problems are recognizable, but not notably deviant for age, sex, or community. This may include truancy, repeated severe lying, or petty theft from family. A 2, this could include episodes of planned aggression or other antisocial behavior. This level should meet the criteria for diagnosis of conduct disorder. And 3, includes frequent episodes of unprovoked, planned aggression or other antisocial behavior. Number 54, substance abuse. This item includes use of alcohol or illegal drugs and misuse of prescription medication and the inhalation of any substance for recreational purposes. Children who are displaying externalizing behaviors may have substance abuse concerns. The item levels for number 54, substance abuse, are 1, mild substance abuse problems that might occasionally present problems for the person. Recovery of less than a year and current abstinence for at least 30 days. A 2, moderate problems that impair their ability to function but does not preclude functioning in an unstructured setting while participating in treatment. And 3, severe substance dependence, conditions that consistently impair their ability to function. Number 58, behavioral regression. This includes shifts in previously adaptive functioning evidenced in regressive in behavior or physiological functioning. A child who is displaying externalizing behaviors may display regression that includes thumb sucking, no longer engaging with peers in an age-appropriate manner, or bedwetting. Item levels for number 58, behavioral regression, are a 1, some regression in age level of behavior. Examples include thumb sucking and whining when age inappropriate. 2, moderate regression in age level of behavior, including loss of ability to engage with peers, stopping play, or exploration in environment that was previously evident, or occasional bedwetting. And a 3 is more significant regression in behaviors in an earlier age as demonstrated by changes in speech or loss of bowel or bladder control. Number 60, anger control. This item captures the youth's ability to identify and manage their anger when frustrated. Children who are displaying externalizing behaviors may have trouble with controlling anger. This item may be correlated but not limited to legal, conduct, and impulse control. Number 60, anger control. Item levels include a 1, some problems with controlling anger. They may sometimes become verbally aggressive when frustrated. Peers or family members are aware of and may attempt to avoid stimulating angry outbursts. There may be a history of physical aggression arising from inability to control anger, but not within the last 3 months. A 2, temper has gotten child in significant trouble with peers, family, and/or school. It may be associated with some physical violence or increased verbal outbursts. And a 3, their temper is likely associated with frequent fighting that is often physical. Others likely fear them. As noted earlier, items within the child risk domain may be scored to capture concerns of externalizing behaviors. For more details on how to score these items, please refer to the link above to watch the on-demand tutorial. The next slides will be some practice on how to score these items. True or false, you would score a 2 for number 52, oppositional behavior, for youth who has moderate problems with compliance with some rules or adult instruction. True. A rating of 2 indicates that the child or adolescent has moderate problems with compliance with rules or adult instruction. A child who meets the criteria for oppositional defiant behavior in DSM would be rated here. How would you rate number 16, re-experiencing, for a child who experienced a traumatic event and is now experiencing occasional nightmares pertaining to that event? 1. This rating is given to a child with some problems with intrusions, including occasional nightmares about traumatic events. True or false? Number 33, social functioning, is about how well the child interacts with peers and is able to make and maintain friends. True. This item refers to the child's social functioning from a developmental perspective. How would you rate number 58, behavioral regression, for a child who has previously been potty trained but is now occasionally experiencing bedwetting? 2. Moderate level of regression, including occasional bedwetting. How would you score 53, conduct, for a youth who frequently engages in episodes of unprovoked, planned aggression? 3. Frequent episodes of unprovoked, planned aggression or other antisocial behavior. Thank you for viewing this on-demand tutorial. If you have further questions, please contact Shannon Krull at shannon.krull@northwestern.edu or Rob Herquest at robert.herquest@northwestern.edu.